If you ever experience sharp heel pain, especially in the morning taking your first steps out of bed, you may be dealing with plantar fasciitis.
That's right. So stay tuned. We're going to actually go through everything about plantar fasciitis, all you need to know and how to pronounce it, and you'll know everything you want and know if you have it or not.
Fasciitis.
Okay, so I'm going to actually redeem myself here, Mike. It's plantar fasciitis. So plantar, we're talking about the bottom aspect of the foot. Fasciitis is talking about the fasciitis is inflammation. So this tissue from the base of the toes to the heel, particularly I haven't marked in green, becomes inflamed, tender, and very painful. Now, the tissue actually does go from the toes and around the heel up into here, but this is what the name refers to. Let's go on to the next thing is some symptoms, Mike.
Some of the symptoms, the major symptom most people complain about is they will have pain typically located near the heel. It can be more forward, a little more back. Somewhere in that region is normally where they feel the most amount of pain.
And oftentimes it's getting out of bed in the morning when the pain is the worst. You put weight on it, and it hurts, and you kind of go like this, and then after about 20, 30 steps or more, it starts to get better, more tolerated.
Yeah, so oftentimes as the day progresses, most people don't feel the pain as much, especially if they're up on their feet and walking around. However, even if they just sit for a prolonged period of time, maybe half hour, they get up again, it often reoccurs. So those are some very common symptoms.
Now, some of the causes of plantar fasciitis is actually the tissues of the plantar fascia get micro tears in it, small tears, they rip, and then they start to heal, and then the next day when you stand on it in the morning, it rips again, re-irritating it. It can go on for weeks or even months. So we really don't fully understand why people get it. We have some ideas. We'll get into that in just a second. Mike, you want to talk about it?
So some things we do know is it is often caused by irritation of repetitive movements. So oftentimes people that run a lot or are standing on their feet a lot for their occupation can have repetitive stress and stretching of that plantar fascia, which can cause those micro tears and irritation.
Right, and a lot of people do complain, say they were pretty sedentary and they started walking or even a jogging program, and that big shift of stress to those tissues starts those micro tears and starts the whole process up. So one or two of those. Foot mechanics can be a problem as far as are you flat-footed or not? And that changes as we age, which relates to what age group normally gets this, Mike.
So this is pretty common between people 40 and 60 years old. However, it can happen at any age, but that's more commonly when it happens to people.
There you go. So if you're experiencing symptoms consistent with what we just went through and it's really bad, you will want to go to a doctor, have it assessed professionally, and get some treatment for it. There are some medical things that the doctor can provide in regards to injections. There's a laser treatment. There's a number of things. Conservatively, Bob and Brad, we do have some good advice on how you can treat this if it's not so bad. Take care of it yourself. Mike, what is that video?
So
we have more than one, actually, but
we have plenty. But if you want to check out some actual treatment options, if you think you have plantar fasciitis, you can click the video link on the screen. Fix plantar fasciitis fast, foot pain gone.
There you go. Or if they do YouTube search Bob and Brad plantar fasciitis, you'll get at least 10 different videos with 10 different options. And,
At least.
Yeah, what do you call that when you watch a video over and over? It's
subscribers, repetitive watchers, binge watching.
There
we go.
Yeah, you can binge watch. That'll put you in a good mood. Have a good day.
Bob and Brad, the two most famous physical therapists.